Thousands of people have died since the conflict began in February, and those who have survived are in need of help. One Augusta nurse is sharing her story after treating some of the children there. We'll get more now in this report.
Today we've had to give blood.
If you visit Augusta University Health, you may run into Elizabeth Curry.
So we help out with any sick babies in the unit. We go to L&D for any high-risk deliveries.
For more than 30 years, she's been a nurse helping the sick and injured. So when she saw the tragedy unfolding in Ukraine after the Russians invaded, she knew she wanted to help.
I had gone in 2004 with a friend of mine and just loved the people there, and so when the war started, I started looking into ways to go over there.
In June, Curry was selected to go with a group. She joined 15 others as they made their way to Poland and then drove to the Ukrainian border.
We saw a lot of soldiers in town, some with guns, some without. A lot of the territorial defense was there. They had the curfew every night from 11 to 5.
Her main focus while there was helping with pediatric patients at a hospital in Lviv.
They were doing surgeries every day, and so we would get those patients back and get them stabilized. And then the night shift took over, and then later in the week we switched up.
She says the group ran into several roadblocks along the way.
We wanted to do dialysis on a couple of the babies, and we didn't have the equipment and the supplies to do it. Ultimately, I was able to put something together that was able to work.
For Curry, those 10 days in Ukraine will be ones she'll always remember, and ones the family she helped will remember too.
Made me feel really good, but at the end of the day, it doesn't do much for Ukraine, but for these kids that we were able to help, it really helped them and their families. It meant a lot to them.
Curry said there is a chance that some in her group from Novik Cardiac Alliance will return in September. If asked to go, she said she will definitely accept that invitation.